I'm Custody Lee, and I'm a certified newborn care specialist and child sleep consultant. And today I want to talk about newborn feeding and sleep and what to focus on in the first 7 weeks when it comes to feeding and sleep. So, if you're pregnant or if you have a newborn, I know that either thinking of feeding and sleep or actually implementing feeding and sleep can be super overwhelming at times. But don't worry, here are some tips that I recommend to focus on in the first 7 weeks when it comes to feeding and sleep. So let's dive in. So, a well fed baby is a happy baby. Yes. However, feeding isn't just about filling their tummies, it's about meeting their needs responsively. And here's what to look out for. Here are some hunger cues to look out for. So, rooting, sucking hands, smacking lips, crying. Crying is a late sign. Let's talk about rooting. So, rooting is a natural reflex that your newborn has. So, if you touch their cheek, they will instinctively root towards your hand. So, let's ensure there's other hunger cues happening so we're not overfeeding our newborns, which can then lead into unwanted gas. If you are bottle feeding or breastfeeding, a few small changes can make a big difference. If you are breastfeeding, ensure a deep latch to prevent nipple pain. Fun fact, nipple pain is common, but not normal. If you are bottle feeding, finding the right position for comfort and to ensure your baby has that perfect latch can make a big difference. Additionally, if you are bottle feeding, I recommend using a pace feeding method to mimic breastfeeding and then also to prevent overeating. So if you feel like your baby burps up a lot or they're super gassy or their stomach is really hard and they're just pretty fussy and you think they may have reflux, during feeding, I recommend side lying. So they're lying on their left side, that promotes digestion, or feeding them upright and then also having them upright around 20 to 40 minutes after they're feeding. Now let's talk about sleep in the first few weeks. Okay, so this is what I recommend. Your baby doesn't know day versus night. So during the day, I recommend the natural light coming in. I'd rather have the natural light coming in versus that artificial blue light and having your baby lay on you. And then at night, making the room dark for making the room conducive to sleep. So allowing your newborn to thrive. So I recommend room sharing, so having the bassinet or crib in your room. However, making the room dark and putting on a sound canceling machine, I recommend brown noise, which are waves. And then if you are going to have a night light on, either have it on red or orange, but dimming that light to like 10%. And then placing your baby in their bassinet at night. This is going to allow them to get accustomed to their bassinet. And so the transfer from arms to crib or bassinet down the road isn't going to be such a struggle because they already are accustomed to it. So after every feed, burp them, making sure there's no unwanted gas, and then laying them back into the bassinet. And then, of course, if there are any times that your baby is awake at night, also place them in the bassinet. This is just so important for sleep foundation and making them accustomed to their environment and keeping it consistent. And just remember, the first 7 weeks is all about nourishing your baby, loving on your baby, responding to their cues, and laying the foundation for sleep. These tweaks along the way will really make a big difference. If you thought this YouTube video was helpful, give it a thumbs up and subscribe. Also, if you are a parent or you're about to be a parent and you would love some more insight about newborn care, feel free to go on my website and schedule a free intro call, or you can message me on Instagram. Anyway, have a great day, guys.